Our faculty to a person are dedicated to making our residents the best surgeon and best clinician they can be.
We truly take care of our residents. We take care of every aspect of their training and ensure that they get the best that we can deliver.
I've been chair of the department in Indiana since 1998, so 22 years now.
Since 2008, Dr. Cook wanted me to be the program director, and I have truly relished that role. My focus is robotic surgery of the kidney and prostate and adrenal gland here at Indiana University as far as my clinical responsibility is concerned. But what's really near and dear to me is taking care of the residents and ensuring that they get really the top-notch training that they deserve.
When I joined, there were 7 faculty, counting myself. Today there's 26 faculty. Over the period of time that I've been here, we tried to expand the faculty, and we are now in many areas that we didn't used to be, including female urology, urodynamics, general urology. We're a very full service provider at this point, and from a training standpoint, we have all areas of urology covered, from infertility to the most complicated cancer care.
One measure is the Doximity Navigator, which ranks the residency programs in the country. In that ranking, we were ranked 14th in the country. Our pediatric program is ranked 2nd in the country. When I came to Indianapolis 18 years ago to join IU, I'd never visited Indiana before. But I can tell you that there are lots of benefits to being in Indianapolis. The cost of living, the proximity of all the hospitals, so residents don't travel for many hours a week between various training sites. Also, we are fairly close to multiple metropolitan areas. The most important thing, as far as I'm concerned, is the fact that we are the only tertiary academic center in the state of more than 6 million population. So that allows us to get all the tertiary care referrals to our program. In our program, the residents get to learn to operate at a very high level, so when they go out and practice, they are the go-to person for complex urologic surgeries. There is early exposure to surgery during the program. So even a junior resident can be involved with retroperitoneal lymph node dissections, for instance, or any other complex surgeries.
The thing that we're most well known for when people seek out training here is the volume of clinical cases that people get. As a previous chair of the Residency Review Committee, I can tell you for a fact that we're in the 90th percentile in the vast majority of cases compared to other institutions in the United States. Our residents are trained to a level that most people don't get at other locations.
On reviewing the logs, the residents focus mainly on complex surgeries, and in all complex urologic surgeries, they are in the 70th to 90th percentile when compared to their peers in programs across the country.
The practice at Indiana University Hospital, where I work, is largely focused on cancer from our standpoint. We do some benign disease, some complicated female pelvic medicine, but the largest amount of our practice at this location is prostate cancer, kidney cancer, testis cancer, and other urologic cancers. Methodist, in contrast, is largely focused on BPH and stone disease. So there's a lot of ureteroscopies, a lot of percutaneous stone surgeries, and a lot of BPH treatment. And then Riley is Riley. It's our pediatric gym, and they do all sorts of pediatric urology there. We're very blessed on this one main campus as well to have our county hospital, which is roughly a half a mile from University Hospital. And then we have our VA hospital, which is a similar distance, very right next to each other actually. So the residents for the most part are on this large city block having all the rotations. We do have 2 suburban hospitals. I practice it there sometimes, so do many of the other faculty. But in general, it's a small component of our practices at those locations.
We have training in robotic surgery using inanimate modules. We have training with porcine labs and virtual reality simulation training. Every resident of ours who graduate is able to independently perform robotic prostatectomies when they graduate. There is a good balance between open and robotic surgery or laparoscopic surgery. Our residents can do complex open surgeries as well as robotic surgery on an equal footing. That sets us apart and allows the residents to offer what's best for this patient rather than be dependent on one approach. There's a big component of research in our residency program. We have databases for research that support clinical research for all our residents. In fact, we require our residents to be involved with research and submit publishable manuscripts. We have excellent and ancillary support to our residents across all training sites. We have nurse practitioners and physician assistants that take care of our residents on the floor in clinics. We also have a lot of educational support for our residents. We have a very generous allowance for our residents every year that allows them to attend meetings, buy books or software or programs. There is a lot of mentorship for our residents when they are interns and their first years of their residency program. We assign specific mentors amongst the faculty so that they have this one-on-one relationship. But after the first 2 years, all of us mentor all our residents, and the residents usually choose their faculty mentors depending on what they want to do. Do they want to go into private practice or academics, or if they are interested in any specific subspecialty. We have a unique relationship between Indiana University School of Medicine and the Moi University in Kenya. The residents have the opportunity to accompany our faculty both to Kenya, to Guatemala, and to other places where they get invaluable experience in these underserved areas, operating almost every day for 1 or 2 weeks that they go with the faculty. When they go to Kenya, they invariably go to a safari, so it's not just work. We have about 50% of our residents going to fellowships and academics. Sometimes it's 100%, but I would say overall it's about 50% go into academics, and the other 50% end up in private practice. In our resident surveys and our faculty surveys that we do annually as part of the ACGME accreditation program, our program fares exceedingly well. In the last survey, in every question, we were above the national mean. So we were doing better in every aspect of our program, and that I think was unique.
I think all of our residents feel that they are competent to perform all aspects of urology when they are done their surgical training here.